The
We'll
numbers.
have a bit of a response. The president spoke for just over 20 minutes. His main focus, as John was just mentioning, is education. But let's talk a little bit to the folks that are going to have to take a look at the budget and see if this is actually something realistic that can pass through Congress. Chairman of the Senate Republican Policy Committee, Wyoming Senator John Barrasso, is joining us now. And let's just get your thoughts overall, Senator, this morning as we take a look at this budget proposal. Your thoughts?
Well, Jenna, first, the president said he wanted to avoid self-inflicted wounds. The two biggest self-inflicted wounds were the health care law that he forced through Congress against the will of the American people and the $800 billion so-called stimulus package, which he said if it passed, by now unemployment rates, he said, would be under 6%. And in fact, unemployment rates have been over 8% for 36 months. I look at that picture of the president and see all those young people behind him, and the budget that he put out today is burying those young people under a mountain of debt. The budget he puts out adds $11 trillion to the debt into the future. So I think that the president has abandoned his role as leader of this nation by not being honest with the American people about the significance of how much money we owe, and a lot of that to other countries, including China.
There seems to be a very stark difference of opinion between Republican and Democrats at this time when you look at what to do for the economy. It seems that the president, along with the White House, has suggested that we do need to spend to continue to stimulate parts of the economy and make sure the recovery continues. The president says you can't cut our way into growth. Jack Lew yesterday, the budget director, says it's not the time for austerity right now. What's your argument for the opposite? Why do you believe now is the time to address some of these major budget concerns like the entitlement programs?
Well, the question is, are we better off now than we were $4 trillion ago? The president, this is the fourth year in a row with a budget of over $1 trillion in debt. It's not working. It is not working at all. And that's why I'm saying we need to focus on jobs and the economy and getting people back to work. But what the president does continues to make it harder and more expensive for the private sector to create jobs. And, Jack Lew was on the morning talk shows. He said it takes 60 votes to pass the Senate and the budget. It doesn't. It just takes 50, and there are 53 Democrats. I'd say, Mr. President, get Harry Reid, the majority leader in the Senate, to ask the Senate to vote on your budget. Let's let the Democrats pass it. They haven't had a budget now pass the Senate for over 1,000 days, and the Democrat leader, the Democrat-controlled Senate, said we're not even going to vote on the president's budget. What kind of leadership is that for this party?
Well, let's take it in a different direction then. Do you see any possibility here within what we do know of the budget proposal? And I know you're just getting a look at it, sir, but do you see any opportunity within the parameters as they've been suggested for compromise, parts that you see that you could get behind as a Republican?
Well, I want to get behind what is real budgeting. What the president has done here is used a lot of accounting gimmicks and budget tricks. I think we have to be honest with the American people. The president ignores the two tidal waves that are coming at us of Medicare and Social Security and the impact that those things are going to do. And I think the president has to be honest with those students when he talks to them about the impact of his current spending decisions on the mountain of debt that is continuing to bury them, this generation and future generations.
Senator, you mentioned health care, and I'd just like to draw upon your expertise as a doctor, an orthopedic surgeon, as I understand it, someone that's probably in high demand for all the different athletic injuries that are out there in this country. But let me just ask you something. Over the last week, we've seen this huge debate happen over the health care law, the contraception mandate, passing that cost from the employer to the insurance company to provide that for free. That's where we left it off at the end of last week. And I'm just curious, just your opinion as part of the medical profession. How do you think the mandate affects the care that we can expect in the future when it comes to our doctors?
Well, I've been fighting through this whole thing for patient-centered health care, not government-controlled nor insurance company-controlled health care. And when the president tries to use his health care law that is even more unpopular now than it was at the time it was passed, and use that to trample on issues of faith, religious belief, the First Amendment to the Constitution, that just shows how powerful the government can be if they try to step in places that we as citizens of the United States don't want. The Constitution was written, as Ronald Reagan said, not to protect the government from the citizens, but to protect citizens from the government. And we saw that very significantly last week, Jenna.
Senator Barrasso, thank you for that. It's nice to get your opinion on a couple different things that are happening, big news stories of the day. We appreciate having you and look forward to having you back, sir. Thank you.
Thanks for having me. Appreciate it.